Greetings and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowicki, representing the Windham 4 District of Putney, Dummerston, and Westminster. Today's show is an update for the legislative session that's going to be coming in January of 2013. We're coming to the end of the new year. One of the issues that has been rising as much as the population has been rising in this demographic is that for elder citizens. And as I look at the color of my hair, changing it, there are more and more of us whose gray is no longer able to be hid or is very prominent. And along with the gray hair comes a lot of other more important issues. Today's guest is Joyce Lemire from Senior Solutions. Welcome.
Thank you. Glad to be here.
Joyce has been working with what was the Council on Aging and now Senior Solutions in Brattleboro, providing services locally to those over 60. Can you talk a little bit about Senior Solutions,
Sure.
and then we can talk a little bit more about legislation that's been and upcoming?
Great. Our agency is a nonprofit, and I feel the need to stress that because I think a lot of people in the community think we're a state agency, and we do receive all of our funding either from the Older Americans Act on the federal level or from state general funds. So we are a nonprofit, we have our own board of directors, and we do not charge any fee for any of our services. We are here to serve people within Windham County who are over the age of 60 and their caregivers.
And you're part of a statewide group, the Area Agencies of Aging?
Yes, there are 5 area agencies that cover the entire state. We meet monthly to make sure that we continue to provide fairly consistent services throughout the state. I think we have a really good network.
Yeah. And what's the service area for what Brattleboro Senior Solutions?
Well, our area covers all of Windham and Windsor County.
Mm-hmm.
So we have an office actually on this floor in the municipal building, as well as one in Townsend, one in Springfield, and one in Windsor.
Mm-hmm. What are the kinds of things people would call you for help with?
Well, we're really trying to promote our senior helpline. This is a toll-free number that anyone can access. Mm-hmm. We have highly trained staff available to start the process as soon as someone picks up the phone and calls us.
And that number is?
And that number is 1-800-642-5119. When someone calls, they will hopefully speak to a real person first time around, who can start with the process of determining what services or what benefits they might have an interest in learning more about. So our agency tries to provide as many resources as possible. If we don't have a solution, we will find another referral source to help people with a solution.
Mm-hmm. Could this be food, medicine, housing that people would be calling you for?
Absolutely. People call because they have questions about Medicare. They call because they need another housing alternative. They may have some nutritional areas of concern to them. Newly diagnosed people may call and say, I'd really like to talk to a dietitian about some of the concerns I have about a different diet, or I need to get onto the Meals on Wheels program because temporarily I can't prepare meals for myself. It really does run the gamut. Mm-hmm. Every day we hear something new that we could never have predicted.
Yeah. Well, it is a changing landscape for a lot of us. As we move forward, January is on the horizon. Mm-hmm. The new legislative session is going to be convening on January 9th.
Yes.
What are some of the kinds of things that you're looking to advocate for? And start with taking a look back at the last legislative session.
In addition to the types of services that I just described, one of our very important roles is to be advocates for the senior population. And one of the ways we do that is by legislative advocacy. We go to Montpelier. We also, one of my colleagues from St. Johnsbury went to Senator Bernie Sanders' committee in Washington to describe the benefits of the Meals on Wheels program. So both on a federal or a state level, we try to educate legislators as to if there's a bill that's available that they're considering. We try to just let them know this is how that bill could affect seniors. and then of course they make the final decision on what direction they're going to take. So a good amount of our time is trying to do research and determine what bills are probably the highest priority for us to follow. This past year, Adult Protective Services, which has been an ongoing issue for the state I've been in my job for 7 years, and it certainly preceded me. So there just have been not enough resources put into that department for them to really do the type of job they would like to do. And so we've done a lot of advocacy work this past year and hope to continue to do that in the coming year to make the state of Vermont a safe place for people to grow old.
Yeah. From my position on the Human Services Committee, these are issues that we have looked at and will look at again. And I mention that because you mentioned an issue that came up last year around Adult Protective Services, which turned out to be the only bill that the governor vetoed last year.
Yes, it was.
Can you speak to that a little bit, what it was about, and why do you think the governor vetoed that bill?
I really can't speak to what the governor's thoughts were, but House Bill 290 was submitted because there remains a number of questions about, there have been, I guess I should start by saying, the current commissioner of the Department of Disability, Aging, and Independent Living, which we call Dale, has made significant improvements in adult protective services. But there are still some areas where the department is not able to follow the state statutes. And those are the areas that we're really trying to advocate if the department needs more staff or more training or other resources, whatever we can do to try to support that seniors are better protected. So several committees had concerns that they wanted more progress reports from the department to determine how things were progressing. And they actually submitted this House Bill 290, which would have required the commissioner to submit progress reports on a fairly regular basis. That bill was vetoed by the governor. I'm not quite sure why. It may have been that he felt that we didn't need to have a bill to have that type of communication between the administration and the legislative body. I can't speak for him, but we were a little disappointed, but you know, you just go on, you make compromises, and we are trying to work with the administration to make things, we all want the same thing, which is for things to get better.
And one of the things that became evident is as the population grows of people over 60 and more people need help to either stay in their home or need to go live somewhere else where they're paying for those services, there needs to be oversight. You mentioned that there is not quite the staffing we'd like to see sometimes in providing that oversight, and I know we went through this with childcare.
Yes.
There was a time where we felt we needed more supervision in that, childcare licensors, and we did. We actually added 2 in an interesting collaboration with the Terrell Fund to move forward and hire a couple more, and we could still use more help in that regard. Similarly with our elders, we want to make sure that people are being taken care of, that people are not being taken advantage of, and that they're getting the care that they're paying for, or in their homes they're being cared for the way they should, and not neglected. And that's one of the other things that the commissioner has pointed out, and I think it's helpful that we now have a commissioner who's actually a geriatric psychiatrist and who has explained in great detail how somebody could be functioning very well, and then 2 months later you start to see the signs of Alzheimer's, and then in 3 months this person is no longer able to take care of themselves, or the medications are not being taken the way they should, and how we need to be vigilant to that. I think that's what the legislature's intent was, to start that process, and I'm hoping we can pick that up again in this next session.
I do too. I think that, you know, the state of Vermont has been very forward-thinking in many ways, including trying to allow elders to remain at home safely versus being in a facility. But the downside of that is that if you're living, if you have some impairments and you're living in a facility, there is more oversight and supervision. And when you're living in a home setting, we have seen a real trend towards financial exploitation, drug diversion,
Yeah.
you know, things that you wouldn't necessarily see if someone were being more closely supervised.
That's right.
So there's, yes, if you ask most seniors where they'd like to be, they will obviously say they would like to remain at home. But we have a responsibility to try to make it as safe a place for them as we can. And there just unfortunately are people out there who will take advantage if we don't set up some kind of measures.
I know in Putney we had recently a unfortunate situation, which fortunately, because our deputy sheriff, Melissa Martin, caught it, brought to justice some people who were taking advantage of an elderly couple in Putney. And this is our job. As the legislature's job, I see it's our job to make sure that our elders are being taken care of. People who've worked hard all their life deserve to enjoy their golden years, and I think it is our job as a society to see that they get the help they need, and whether it's making sure they're not taken advantage of or just getting what they need. Are you advocating for any new legislation this year?
We are still, we had a much busier, I'm the chair of the Community of Vermont Elders Policy Committee, and so a number of us met all through the summer to just talk about what the priorities could or should be, but I think it's still too early for us to, we're waiting to see what the bills will be that will actually occur, and then try to set up priorities as to which ones we should spend our efforts advocating for. So it's still a little early, although it was a pretty busy summer, and you're on that Health Access Oversight Committee that continued to meet all summer long. And, you know, so I think some people in the state may think that people in the legislature go home for the summer, but that isn't always the case.
No, we keep working, although we do have our real jobs, our paying jobs to go back to. And I should say that now that the election's over, the bill drafting has started. So if there are ideas that you have in mind, you can get in touch with me or anybody, any of the representatives or senators in Windham County to put some ideas forth. And the earlier we get bill drafting in, then our legislative staff can get to writing those bills, and we can consider them in committee.
Well, there was one other issue in terms of what we call dual eligibles, and I had testified to at your committee last year, and that is for people who are eligible for Medicaid as well as Medicare, that the state will be initiating a special managed care healthcare program that would cover all of the seniors' medical needs, including their prescription drugs. And we've, along with AARP, have tried to stay very close to the planning process that has occurred. And we still are feeling really comfortable that this plan will be a good thing for seniors to take advantage of. It will be voluntary, but we do believe that we will be encouraging them to consider that. But there's still a lot of work that has to occur, and I'm sure you'll be hearing a lot more about the little tweaking and turns that will occur during the course of this coming year about that.
Now, you mentioned your connection to the Cove group.
Yes.
There's another local connection to the group, Ginny Milkey.
Yes, Ginny Milkey is the executive director of the Community of Vermont Elders, and has been a really good asset. I'm on the board of Cove, and Ginny has been able to establish relationships because of her long-standing respect that she's been able to garner in the legislature, that when she does testify, people know that she's saying something that she really believes in, and I think they do listen to her. So we are really lucky to have her as a really strong statewide advocate.
I think it's one of those instances where people look at the political landscape in Vermont, and it's not that hard to understand. It's not as complex or multi-layered as it might be in Washington, and the people who are out there working as advocates are people we know from from our towns who have specific interests in that topic.
Yes.
They're not just hired guns trying to throw money around and make money. Ginny is involved in this because she's been active in these issues for a long time, and like you said, she has the respect as a former legislator, so it's easier to work with somebody like Ginny.
It really is. I think Vermont is a special place. I hear frequently from elders that what they really enjoy is that the local legislators are their neighbors, that they have always been receptive to hearing their concerns, and that doesn't happen in all the other states. I think this is a special place. People do feel like they have a voice, that they can share their views, whether you will agree with them or not. At least there's a respect and a sensitivity to listening to everyone, and I think that's really, it makes the job a lot more fun, so to speak.
Well, from my perspective, I think it makes us more efficient and effective as well, and in doing our job, which I think is the work of the people. And as I said, when it comes to our senior citizens, these are people who've worked hard all their life and deserve to be enjoying as best they can their golden years. So I feel it's inherent upon us to be doing the work. And I should say that the department that this is part of, Department of Aging, Independent Living, and Disabilities, is often a part of our government that we don't hear that much about. And it's one of the reasons I appreciate your advocacy, and I feel one of my jobs in the legislature is to be a voice for those without a voice. There are a lot of interests who can hire high-priced lobbyists, and they're going to be heard. There are another groups where there are lots of people who are engaged in advocacies for various issues. And the disabled, our children, the elderly don't always have those advocates there. So that's one of the reasons I feel your work is as essential as anything that helps move the legislative process forward.
Thank you.
Yeah.
I think that in partnership with COVE, the Community of Vermont Elders, we are always looking to see if we can find seniors anywhere in the state who have an interest in testifying or getting to know the legislative process better. Ginny is more than willing to do some educational programs around how important it is for seniors to feel they can go to Montpelier and share with any committee their views on things. And I don't think that happens as often as it could if we were able to encourage people to do that. And that may help. It might help if one of us were able to drive them there and, just make it a little easier for them to access their government.
One of the things we looked at and have been looking over the past several years is the Choices for Care program, which helps elders stay in their homes longer than they might otherwise and provide services for them. There's another program that started as, I think, an experiment in Burlington, the SASH program, which is now being spread around the state. Can you talk about that program a little bit?
Sure. The SASH program is also federally funded at this point. It's had special funding. And this is a program that is starting out in the housing facilities, the state or federally funded housing facilities. So in our area, Brattleboro Housing Authority has initiated a SASH program. And they have hired a wellness coordinator and a SASH coordinator who work in tandem with nursing staff at the hospital. So the goal is to try to offer seniors, as they're aging, whatever preventative services and supports that can be offered to keep people healthy and successfully aging. And so the first pilot project was at Cathedral Square in Burlington, and it was extremely successful, and it's slowly starting to move into other areas. Brattleboro's the SASH program there has been around for probably in their second year now. Springfield just started one, and it's only been open for a few months. But I think when you're collaborating with the hospital staff and social service programs such as ours, you try to prevent that duplication of services. So if I've already asked this person 32 pages of assessment questions, if they're willing to give me permission, I can pass that on to the SASH coordinator so they don't have to ask it all over again.
Yeah.
And I think we've really made some strides, especially with people who are like newly diagnosed for some kind of a chronic disease, that if we can help them right at the beginning,
Yeah.
to get on the right road, they're going to just live a much happier life.
Yeah.
So it's a pretty exciting venture.
Yeah. Well, we're hoping that it can spread and again help people stay in their homes longer, and if they're currently living not in their own homes, to get a better level of care.
Absolutely.
Yeah.
Yeah.
Yeah. As the session moves on, we're also going to be looking at a couple of other issues. Is there anything else? And I can mention them in a minute, but are there pieces that you want to mention before we?
I think one of the things that I'd just like to announce to the viewers is that we were informed that the federal government had appropriated a certain amount of money for fuel assistance for this coming year. And it was far less than what we had hoped to receive because the cost of everything is going up. But in the last couple of weeks, the Vermont Emergency Board has appropriated a sizable amount of money that will keep us at the same level of funding that we had last year, which is a wonderful gift to people who are low income, who are going to be relying on assistance with their fuel or some type of heat. I'm just delighted that the state government was able to intervene this quickly, so that as we get these calls where people are saying to us, what am I going to do? We can say, don't worry. We'll be able to probably get to refer you to whatever fuel spot, whether it's the local CAP agency or wherever, to get the fuel assistance, or we'll help you fill out the applications, but you're going to be okay.
Yeah.
And that, I think, is just peace of mind for a lot of people.
Yeah, I know last year we were in a similar situation where federal funding had diminished, and the state stepped up with strictly state dollars to help make up the difference, and we're doing it this year. And I applaud the governor for his leadership on that.
Absolutely.
I think the other piece of that is that the money will be dispersed more easily, and I think however you access, whether that's through SEVCA or other local agencies, that my understanding is that money will be able to be dispersed a little more easily and maybe earlier this year than it has been in past years.
I believe that's correct.
Yeah. And again, that's something else people can call your agency with.
Absolutely.
To help. And that number is?
They can call our senior helpline number, 1-800-642-5119, and we will give them information about the fuel application, help them fill it out if they need some assistance, but give them the parameters in terms of when it starts and when it ends. So I just don't hesitate to call our senior helpline.
Food is another issue.
Yes.
That whether it's the elderly, young people, what are the options that, or what can people look to you to get help with?
I think food insecurity is probably the one area that is almost a universal concern. It almost doesn't matter what your political beliefs are. When it comes to the thought of anyone of any age not having enough food in our country, it is something that just touches us all.
Yeah.
Now, we have the Senior Nutrition Program. We receive USDA dollars, and we have contracts with 34 different agencies in Windham and Windsor County, and appropriate over $1 million a year to the communities to offer either congregate community site meal or the home delivered meals. We're keeping our fingers crossed that we're not cut to the extent that we're concerned about on the federal level, but we have budgeted for slight increases to all the meal sites for the current year because the cost of food and packaging continues to go up.
Yeah.
So in addition to that, we try to help advocate for the local food shelves. But as you know, it's no sooner is there a project that where they fill their shelves and it's empty again, and it just continues to be an ongoing dilemma. For our purposes, the area agencies on aging are really trying to look at whether we can find some Vermont businesses that would be willing to adopt this program, so that over the next 5-10 years, if the funding on a federal level continues to reduce, is there a way that we can still offer food to people who really need it in some shape or form?
Yeah. I know the food bank also has been helpful.
Absolutely.
Right here in Brattleboro.
And, you know, a lot of the meal sites use fresh produce as much as possible. For some, it's more difficult because they need storage, they need more freezers or whatever, but everyone is trying to utilize whatever they can locally and with donations as much as possible. Sometimes people get sick of, you know, summer squash at certain times of the year, or tomatoes, but no, I don't either. A good red juicy tomato is very rare for us Vermonters. So
we take them those few months we get them.
Yes, we do.
One of the concerns that I've had working on the House Human Services Committee, and that we've been trying to spread the word about, is advance directives. An intentional process of writing down the health care that you want or don't want as you reach the end of your life. Vermont is unique again among other states in that we have not only a process for helping with that, but we have an online registry now. And what we're trying to do is get higher percentage of people to not just write out their advance directives, but then to post them online so they don't have to carry them in their back pocket. Is this something that people can call Senior Solutions and get help with?
Yes, absolutely. Our staff on the Senior Helpline would be happy to start the process, the conversation with them. And it just continues to, I mean, even with the current legislation, there's the Vermont Ethics Network is still working on trying to continue to make improvements to that. I was just reading some notes yesterday about the fact that you can go into a lot of stores and get a bracelet that says you have advanced directives, which to physicians and EMTs is meaningless. So, you know, there's still a lot of work we need to do in terms of educating people as to, and I continue to stress to the people that I meet that it's really important that you have these conversations with your children, that just having it with a spouse or a close friend is not going to be enough. You really need to have these conversations with your children so that everyone understands what your views are.
Yeah, I think our experience is that it makes it easier for everybody.
Yes, it does.
We've only got a couple minutes left. Anything that we didn't get to that you want to, before we finish up?
I guess just to stress to people that if they have questions, if you're over 60 or you're a caregiver of someone and you have questions about Medicare or fuel or food or housing, not to hesitate to call our Senior Helpline. If all three staff are on the line, just remember to leave your name and telephone number and someone will get back to you shortly.
Yeah. Well, thank you so much. Thanks for your work, and thanks for taking the time here to share with more people around town the good work that you're doing.
Well, thank you for having me.
Before I close, I did want to make an announcement that Senator Jeanette White and I have been working on another issue, which is death with dignity. We're going to be holding a public forum on December 18th at 6:30 at Brooks Memorial Library. People can come and share their opinions on this. We will be looking at this in the upcoming session, and we will be having a public hearing up there, but we know it's hard for people in this area sometimes to get up to Montpelier, so that's why Senator White and I will be hosting this forum at Brooks Memorial Library again on December 18th. I think it's a Tuesday night from 6:30 to 8:30. There'll be more information on my website, and maybe BCTV can do likewise. If you have any questions, look on my website, Windham4, that's the number 4.net, and there's a lot of other information on there as well. So Thanks again, and thanks to you, and thanks to BCTV once again for making available the studio space and the staff to put this program and share this work with you.